Michael, thanks so much. It may take your breath away to know just how important lung health is, especially when so many people take it for granted. Well, this week is National Respiratory Care Week, and here to tell us more about its importance are Baptist respiratory therapist Sharon Hill and James Corbin. Thank you both so much for being with us today. Now, this is a big week. It is National Respiratory Care Week. Why is this week so important?
Well, this week is important because we want everyone to know what we do, and we want to thank all of the respiratory therapists internationally for all the hard work they do and for the health care that they give to the people in the communities.
Well, let's talk about the role of respiratory therapists. We usually see them in when they're doing breathing treatments and after procedures. They have you breathing into the machine. But what exactly is your role?
Hopefully that's all that you'll ever see us do. We are cardiopulmonary specialists, and like I said, hopefully all you ever have to see us do is a breathing treatment or an incentive spirometer, the name for the breathy bottle thing. But when the chips are down, we're the people that breathe for you.
Let's talk about some of the kinds of lung diseases that you see and that you help patients with.
Well, a lot of things we do, anything doing with cardiopulmonary. We have asthma, there's lung cancer, we have COPD, which is chronic obstructive pulmonary disease. It comes from smoking. And then you have interstitial diseases like sarcoidosis that can be caused by chemicals and everything. But anything to do with breath and breathing, we're there, because without breath, there's no life.
And you do that not just for adults, but children as well. You work in all areas of the hospital.
Yes. I'm sorry.
Go ahead. No, go ahead.
Yeah, in the neonatal areas, from neonatal to older people. We have premature births, and we help the babies to breathe because their lungs not developed. And then you can go all the way to the elderly. We help them when it's hard to breathe. So anybody in between, we are all there, and we are right there by their bedside.
We hear so much about smoking cessation programs. Why is it so important not to smoke, or if you are smoking, to stop smoking as soon as possible?
When you smoke, the chemicals that are in it slowly damage your lungs over periods of time. You might feel fine after you have your coughing fit in the morning when you wake up, but the longer you do it, the worse the damage gets, and it accumulates over time. And we suggest that you stop if you can. But no one expects you to have to do it by yourself. Talk to us, talk to your family members. I actually used to smoke quite a bit, but once you make the decision to quit, it has to be you.
Exactly, and there's help out there.
There is.
Well, let's talk about sleep apnea as well. And it's more than just snoring. We know that that's a part of breathing, but tell me about sleep apnea and what that has to do with your respiratory care.
Well, with sleep apnea, it happens that it's apnea without breath. And when you go to sleep, your body relaxes. So we have a lot of people that are obese, and when your body relaxes and you have your tongue relaxes and it blocks the airway. So what we're doing is we monitor the sleep apnea by doing sleep studies. And we observe the person while they're sleeping to see if they stop breathing, and then we work on that. And then what we do is we apply CPAP or BiPAP to them if they need that air to breathe.
And I've seen the CPAP machines, and it's amazing how far they've come. They used to be very big and cumbersome, and now they're more compact.
Yes.
They are about as big around as a tablet, and maybe as tall as a piece of bread. And they make almost no noise. Yeah.
It's amazing. Well, let's talk about people in the community. So many of us, as I said, take our lung health for granted. How can people in the community help to improve lung health, not just for themselves, but for others as well?
The number one thing is education, to be educated about it. In your doctor's offices, in your clinics, you have pamphlets. If you don't know, you can ask someone. And we like to tell people always, everything is transferred by our hands. So if you keep your hands clean, if you cough and you cover your mouth, keep your hands clean, and we can prevent things if we just know what to do. So if we get educated, and just ask your doctors if you don't know.
Well, thank you both so much for being with us. Again, we've been talking with Sharon Hill and James Corbin. They're with Baptist Health Systems respiratory therapists, and have a great week. Thank you for wonderful information.
Thank you for having us.